The Biden administration using illegal immigrants, or urging them, in fact, to get COVID-19 vaccinations, despite new data showing Black and Hispanic Americans are receiving just a fraction of the available doses. Joining me now, Fox News contributor Gianno Caldwell and Florida State Congressman Daniel Perez. Gentlemen, thanks for being here. I mean, Gianno, these numbers are bad. Take a look. 5% of vaccine supply given to Black Americans, 11% of the vaccine supply given to Hispanic Americans. Those numbers do not track with the population. Shouldn't the emphasis really be on raising those numbers, the ones you see on your screen, versus prioritizing illegal immigrants?
I 100% agree. And if we were to look at data that was provided by the National Urban League, they say that African Americans are 3 times more likely to be infected by COVID-19 than their white counterparts, 2 times more likely to die from COVID-19 compared to their white counterparts. Knowing that African Americans are 13.4% of the U.S. population, this should be a priority. But African Americans has a fear-based system of vaccines. And we know this because of the 1932 Tuskegee experiment, which 600 African American men were lured in with the idea of free health care. Sharecroppers who may have never even seen a doctor were stuck with syphilis. So this created a narrative that government can't be trusted. And Kamala Harris incited greater fear of this narrative by saying that she couldn't trust the vaccine that was produced under the Trump era. This has hurt African Americans throughout the country in urban centers, and Democratic politicians have parroted these same talking points, which leaves us in a very unfortunate state now.
Very unfortunate, but also very dangerous, because people could die because of this. Daniel, here's what the DHS in the Biden administration has to say. Quote, "It is a moral and public health imperative to ensure that all individuals residing in the United States have access to the vaccine. DHS is committed to ensuring that every individual who needs a vaccine can get one regardless of their immigration status." I mean, look, Daniel, I understand this herd immunity argument. The more people you get shots in arms, the better it is for everybody in general. But how frustrating is a statement like that for your constituents who want to get vaccinated themselves but could fall behind priority to illegal immigrants?
Yeah, Todd, and I think that's the most important part of this entire discussion. If there was a surplus of vaccines available for those individuals that live in the state of Florida, then that'd be a different conversation to have. But I can tell you right now, the amount of individuals that want to receive the vaccine in Florida outperforms what's actually available today. And that's just not for the Hispanic community and for the African-American community, but across the board. When we're talking specifically about the Hispanics and the African-American, I mean, we have about, I want to say 90,000 vaccines that have been provided to the African-American community in Florida, and about 150,000 to the Hispanics. Gianno's absolutely right. The messaging is poor. There is a fear of government, of the vaccine, of COVID, when those are the communities that should be most concerned just based on pure numbers. But what we've been able to do here in Florida is we're trying to infiltrate those communities and message a little bit better. And the way we've been able to do that is we've now got into places of worship. We're hoping that maybe the places of worship can get into these communities a little bit better than the government does. And, more often than not, other entities outside of the government do a better job than the government itself. So we're up to 25 right now in the state of Florida, and we're going to get up to about 50 in the next week. And we have complete involvement from the Black Caucus here in the Florida House and the Florida State Senate to make sure that we're into the communities and we're helping as much as we can. It's a smart approach. One more question for each of you, 30 seconds on the response. Gianno, the left pushes equality, now calling it equity. Then why aren't blue states doing better vaccinating Black and Latino populations?
Well, in my view, it hasn't been a priority. I think largely COVID has been politicized by Democrats. And honestly speaking, this is something that has to stop. This shouldn't be going on in any administration. These are American citizens that deserve the help. And a lot of African Americans are dying at record numbers, or rather being infected at record numbers. And that should never be the case. So we need to move forward as a country united in providing help for all.
Daniel, you gave great answers as to what you're doing to increase awareness and help vaccinate your community. What can the rest of the country do to follow suit? I think Florida's been a leader in using the private sector. Most of these left-leaning states are doing 100% government-ran distribution of vaccines. It's what
President Biden wants to do as well. And here we have a great network of private partners where we get it out as quick as we can and right in front of the people that want it and need it the most. It's just a matter of a private-public partnership, and most of the left-leaning states, they stay away from the private sector.
It doesn't make a lick of sense why individuals based upon the color of their skin are or are not getting this vaccine. We all need it. If we want to get it, we all need it. We all should get it, regardless of our skin color. General Caldwell, Daniel Perez, we appreciate your time this morning and your insight. Jillian, over to you.
Thank you.